On March 23, 2010, President Obama signed into law the Affordable Care Act, or the ACA. A lot's been said about it. Some people claim it's 2,000 pages or 2,400 pages. The fact is, the Affordable Care Act is 906 pages long, 422,000 words. It's actually about the same length as a Stephen King novel. Not that long when you're revising the whole American healthcare system. The law has 10 different titles. The first title is about quality and affordable healthcare for all Americans. The second title is about the role of public programs like Medicaid. The third title is about improving the quality and efficiency of care. The fourth title actually goes to prevention of chronic disease and improving public health. The fifth title is about workforce and making sure we have enough doctors, and especially primary care doctors. The sixth title is about transparency, fraud and abuse to try to reduce those problems. The seventh title is improving access to innovative medical drugs and devices. The eighth title is about the Community Living Assistance Services and Supports Act, or the CLASS Act. Actually, it was repealed after the passage of the Affordable Care Act. Title IX is about revenue provisions, paying for the Affordable Care Act. And the 10th title is about reauthorizing the Indian Health Care Act. A lot also has been said about the fact that the Affordable Care Act is all about access. 90% of it is access, some people claim. Well, that turns out not to be true. Only Titles 1 and 2, total of 222 pages of the 906-page bill, deal with access provisions, expanding Medicaid and the exchanges. The Affordable Care Act is much, much more than access. But because access is so important to the bill, we'll start there. The Affordable Care Act makes four major inroads on access to try to get Americans coverage. First, it reforms the individual insurance market to make sure it works better. Second, it has mandates both on individuals and employers to make sure they cover themselves. Third, it creates the health insurance exchanges, a way for individuals to shop for coverage. And last, it expands Medicaid. We'll take a look at each one of these provisions in detail. We'll start by considering the insurance market reforms in the Affordable Care Act. One of the most popular revisions is allowing young adults to stay on their parents' plan until they turn 26. Before the Affordable Care Act, most children had to leave their parents' plan when they turned 18 or when they graduated college. But the Affordable Care Act requires that health insurance companies keep them on their parents' plan until they turn 26 if they want. A second provision relates to something called rescissions. It's a pretty nasty practice by insurance companies where they would sell an individual an insurance plan, get their past medical history, and if someone forgot something or made a mistake, they would actually cancel their plan right when they needed the health insurance coverage for an accident or a surgical procedure or cancer. That has been eliminated. Obviously, if individuals lie or falsify their medical history, they still can be thrown off. But for honest mistakes, insurance companies can no longer rescind the plan. Another provision of the insurance market is to remove annual or lifetime limits. A lot of insurance companies put on limits as to how much coverage they would pay for over someone's lifetime, for example. $1 million, and if you went over that, the insurance company would no longer cover that. That has been gone because of the Affordable Care Act. Pre-existing conditions and guaranteed issue also were important issues where companies could not exclude individuals from coverage because they had had a pre-existing condition like cancer. Finally, there were adjustments to create a baseline that every insurance package had to cover, the essential health benefits. There are 10 of them. Ambulatory patient services, going to the doctor's office, for example. Emergency services, if you got in an accident or something dreadful happened, you had a heart attack, that had to be covered, going to the emergency room. Hospitalization if you needed an operation or some other condition. Fourth, maternity and newborn care. A lot of insurance plans didn't cover women having babies. Fifth, mental and behavioral health issues have to be on an insurance plan. Sixth, prescription drugs so that everyone has coverage for their drugs. 7, rehabilitative services in case someone has a major stroke or paralysis to make sure that they can be rehabilitated. 8, laboratory tests and radiological procedures have to be covered. 9, chronic disease management. So if you have heart disease or emphysema or diabetes, managing those services has to be on an essential health benefits. And last, pediatric care, care for children that includes dental and vision care, has to be part of an insurance plan. Those are the 10 essential health benefits that any insurance plan has to have if they satisfy the new coverage provisions in the Affordable Care Act. So those are the reforms to the existing insurance market. The next thing we're going to turn to is the individual mandate.